So here are the main points of the plan. We've got doubling medical school places to 15,000 a year, increase the NHS workforce by 300,000 by 2036-37, a consultation on cutting medical degrees to 4 years from 5, doubling nurse and midwife training places to 24,000 per year, and 1 in 5 clinical staff to be trained through apprenticeships, as well as plans. They are backed by £2.4 billion over the next 5 years. Part of the plan, this is a little bit of a controversial part of the plan, is to slash the medical degrees from 5 years to 4. That's in a drive to put tens of thousands of extra doctors on hospital wards. David, I'll come to you first. What do you make of that particular thing, cutting training from 5 years to 4 years? Do you worry that that could mean we have inexperienced doctors without enough qualifications?
Yeah, I mean, it sounds good, the whole plan, but this is a little bit of a thorn in the side of the plan because you can't do it on the cheap. You know, you need to train doctors properly. They need a hell of a lot of training. They need 3 years academic training. I mean, it used to be 3 years clinical training, and then before they become junior doctors. So to bring that all down to 4 years, I think really is cutting corners. So, yeah, I would get rid of that bit of the plan. And, you know, the thing with this is they say they got £2.4 billion for this. I assume that's over the whole 15-year transformation, which really is nowhere near enough to train an extra 60,000 doctors that they want and 170,000 nurses over the time. So if this is going to be something in order to do this on the cheap, then that's really scuppers the whole plan in a way.
Daniel, is this doing it on the cheap or is this just pragmatism?
I don't know. First of all, I think it's very good to have a plan because
yes, it's nice.
Well, it's more than just nice. I mean, we recruit huge numbers of people from overseas to come and work in the NHS when we could be training people here in this country to do many of those jobs. But you can't train people overnight. You've got to have a plan. You've got to have the training places for them. You've got to be able to recruit them and so on. If I had any criticism of the plan, it would be that it's a bit too slow in building up the training places that we're going to be offering. Turning to David's point, it's true that you won't be able to do this on the cheap. People are going to have to pay more through their taxes in order to have this. That's absolutely true. There might be some savings because you could be replacing quite a lot of agency staff that you have at the moment. I think that would be part of the plan. Those agency staff are quite expensive to employ, or they're not employed, but to use. If you can replace a lot of the agency staff with permanently employed people, you're probably in a better place financially. So there will be some savings, I'd hope, in that direction.
Yes, the Prime Minister has said that could... Well, there could be billions in savings by not using agency staff.
Well, but all billions is nothing in this.
But of course, we've had to use agency staff because of all the strike action.
Billions here, billions there. You know, I mean, you know, yeah, you can save billions. That could be a lot, could be a little, depending on the context. But you could certainly save money from doing that. So I think that's very encouraging as well. There is a point. David has a point. I think the truth is, at the moment, medical places for studying medicine to be a doctor are very hard to get, and so they tend to be some of the brightest people are the ones who actually get into those slots. Of course, if you open it up to a much larger cadre of people, then you'll be going further down the scale. If you shorten the training, then you might not be getting what you absolutely need. But then the question really is, with modern AI and all of that, do you need all of your doctors to be as qualified? Now, you say that probably shock you. But if you think what the average GP is doing, when really much of the time they're identifying symptoms, which they're now assisted in by technology and by computers and by references, and then they're referring people with those systems to specialists in hospitals, consultants and people who actually have expertise in what they think might be the cause of that. You know, it isn't necessary for every GP to be absolutely the bee's knees at everything.
Now, the government says that this is... Sorry, David. The government says that this is the biggest reform since the NHS was started, I believe. But is this actually a reform? This is just simply throwing more money into recruitment, which is a fantastic thing. We need more doctors, we need more nurses. But is this almost a sticking plaster for a system that is failing beyond just staff shortages.
Yeah, right. It's throwing money at a problem which is very clearly there, that we are relying on migrants to come in who are qualified, who are good.
Apparently, just on that point, apparently nearly a quarter of our workforce in the NHS is currently recruited from overseas. They want in 15 years' time for that to be at around 10%.
Yeah, and that is a good aim. I think they've been reading our manifesto, actually, because that is one of the points that we need to make sure.
Labour says they've been reading theirs.
Yeah, indeed. But, I mean, absolutely, and that was how this was presented, and that was the headline in a lot of the reports today. And that's an admirable thing. We should be training enough British people to do all the jobs that need to be done in this country, and that includes doctors, nurses, midwives, GPs, and other specialist doctors. We shouldn't be taking doctors and nurses and midwives from other countries who have trained them, and they've invested in their young people where we haven't, and that's been going on for 25, 30 years. So this is a problem that needs to be rectified. I don't think it's the biggest reform in the NHS's history since 1948, but it is a good ambition to do this. It's an ambition that I would have. But in terms of reform, he hasn't really said much about that at all. I mean, it is grossly inefficient. You have these PPIs from the Labour days where you have contracts, for example, if you want to change a light bulb, you have to call a certain contractor and they'll charge you £80 to change a light bulb or something.
But is that just the public sector, or is it particularly bad in the NHS, Daniel? Because last time I looked, the NHS employs 1.6 million people, making it one of the biggest employers in Europe, if not the biggest employer. Is it impossible with an organisation like that to run it efficiently?
Under these plans, there'll be 2 million employed at the end of the 15-year period, so 1.6 will be a pleasant memory.
That's very interesting, actually, how much power NHS staff will have over the government, if you see it that way, in terms of strike action, in terms of bargaining power. 2 million people being employed by one publicly owned organisation. Quite incredible.
And the other thing I wanted to say was this 2.5 billion is going to go into wages. It's going to go into staff. It's going to go into staff pockets. None of it is going into producing better health outcomes, which is, after all, if you bear it in mind, is what the NHS is about. A better health outcome, for example, is a longer cancer survival rate. That's a better health outcome. Now, the purpose of the NHS is not simply to employ people. It's to produce better health outcomes. And the 2.5 billion isn't going into the equipment, the technology, the stuff like that could be producing those better health outcomes. That, if it's going to happen at all, will have to come from somewhere else. And as we know, the government's credit card is maxed out at the moment, now and for the foreseeable future.
Well, I mean, I would agree with you there, because this government has been so grossly financially irresponsible over 13 years that they make Tony Blair look good. And instead of actually spending money on something that is good, and they've wasted money on net zero, they've wasted money on furlough and lockdowns, which were unnecessary. Now they're wasting money on the Ukraine war, which we shouldn't be involved in. They're wasting money on HS2, on diversity officers, on migrant hotels.
Well, on
a
the
whole
point,
range
David,
of things that they could spend
on the point of Tory failure, Daniel, Neil's just written in, he says, remember, the Tories cut medical school places and removed nurses' bursaries. Cameron and Osborne decided it was cheaper just to recruit from abroad. That's a fair point, isn't it? Do we reap what we sow? Have these problems been, political decisions?
There are political decisions have been made, but I just want to put it back to David. I mean, the next thing, in 2 minutes' time, you'll turn around and David will be explaining about the Tories giving us austerity. That's the other complaint you get. Austerity.
We never had austerity.
High expenditure the other moment. Political decisions are made in the circumstances in which they arise. And it's true that we did cut back on money spent in public services without any noticeable falling off in outcomes, which is what really matters.
Just very quickly, David, obviously it's all well and good planning for the future and all these new nurses and doctors you're going to hire and train in this country. But what about right now? We have we're finding it difficult to retain staff. People are moving elsewhere or retiring early because of paying conditions, is what they say. Do we need to bite the bullet and up their pay?
I think pay needs to keep pace with inflation. You know, but what we've got is two extremes at the moment. The BMA are asking for 35%. The government's offering 5%. They need to reach a happy medium because inflation is 10%. So in order for people to have the same purchasing power, they need a 10% pay rise. I think that would be a solution to the problem.
And Daniel, just one last question. Is the NHS worth saving?
Well, we need a public health system, and the NHS is the one we've got. Whether today you would actually decide to nationalise and have a single organisation providing your health, providing your publicly funded health, no other country has done that. I know with the left, they're convinced this is the best model in the world, but nobody else has copied it. And whether you get the best outcomes from that, whether you get the right amount of patient choice, almost zero, whether you get the right amount of patient waiting, proper treatment of patients, so they're actually treated like adults, people who can make appointments which you can turn up for and actually you have the appointment at the time that it was agreed.
That'd be nice.
Or you come, or what happens now in most hospitals is you come in a 4-hour slot, you know, and you queue up in your 4-hour slot. Accident and emergency, is that, you know, is this the best system we could devise? If we were starting today, almost certainly we'd say no. We'd look for best practice elsewhere in the Western world, and we wouldn't come up with this.
Well, but yes, I don't think there's any appetite.
But we've got it.
There's no appetite for root and branch reform. This is what we've got. I'd argue that we should probably be thinking a little bit bigger. At the moment, it's all sort of sticking plasters, but we must welcome more doctors and nurses, I think.